Welcome to Health Focus. I'm your host, Dr. Scott. Today we're focusing on National Traumatic Brain Injury Awareness Month. This is a public awareness issue that many people have been reading about. We've seen high-profile cases of aging athletes with cognitive difficulties that might be related to head injury. But what we're trying to do here is to really increase the awareness for all members of the community, because this really is a problem that can affect everyone. So today we're going to focus on how to prevent traumatic brain injury and how to treat it. And we're very fortunate to have with us Dr. Nicholas Capozzoli. Nick's a friend of mine for many years. We used to practice together at state hospitals, in fact. And Nick is a neurologist with really excellent training who really is a superb clinician. So welcome to Health Focus, Nick.
Thank you, Scott.
And let's just jump into it, shall we? Traumatic brain injury, I've read, accounts for about 3 million emergency department visits per year, and perhaps twice that many visits if you include, for example, people going to their own doctors, so perhaps another 6 million.
Yes.
And I understand we are talking off air that the figures on just the frequency of this are quite amazing. Could you kind of share that with us?
Yes, the CDC collects data. The most recent data that we have from them is from 2014. But in that year, or the year before that, there were about 2.5 million visits to the emergency department for traumatic brain injury, sometimes associated with other injuries as well, other somatic injuries. Of those, about maybe 250 to 300,000 result in hospitalizations, and about 50,000 deaths a year, which is a significant amount of morbidity and mortality from this condition.
Indeed, and also I think that in years past, many people would just shrug this off. For example, in hearing interviews with old football players and boxers from, say, the 1960s and 70s, they would be told, well, you know, you got your bell rung, just shrug it off. I hope we're moving past that. What do you think?
Well, yes and no. Basically, we're talking about a couple of different kinds of traumatic brain injury. There's what you call mild traumatic brain injury and moderate and severe traumatic brain injury. The kind of head injury that people shrug off is kind of what you describe as having your bell rung. These would be described as mild concussions, and most of those don't result in serious long-term problems. The point is that about even 15% of these so-called mild concussions leave people with serious long-term issues. So people, we're made a little more aware of it nowadays because of the issues that cropped up in the National Football League with the chronic traumatic encephalopathy. So people are a little more aware of it, but there's still this kind of lack of concern for these mild bumps and knocks on the head that people get, even playing sports, for example.
Right. We mentioned high-profile cases. I'm reminded of Muhammad Ali.
Yes.
I think it was estimated that he suffered 80,000 blows to his head during his career. He was the greatest, just a superb boxer and athlete, and yet he ended up having Parkinson's, which arguably could be attributed to head trauma.
Right, and that's an interesting point because, one of Ali's main themes was that you couldn't really touch him. He never got really knocked out. It doesn't take actually being knocked out to create a brain injury. Just being tapped on the jaw with a significant amount of force can shake your brain up a little bit and cause problems that you may not realize is serious at the time. You don't have to be knocked out to have a concussion. That's a misnomer.
So actually, explain to us, if you would please, Dr. Capozzoli, when you say a concussion, what does that really mean? When do you cross the line from an insignificant head injury to a concussion?
Yeah. Well, as I was saying earlier, not every knock or bump on the head is a traumatic brain injury. The brain was, evolved in the human skull to take a certain amount of bouncing around. Otherwise, we wouldn't be able to, do things that we do in daily life. But a concussion is defined as an injury to the brain that causes its function to change. It disturbs the normal function of the brain. The normal function of the brain includes being awake and aware, and that's consciousness. So if you're knocked out, you're unconscious, that's clearly dysfunction. And so we recognize that, and most people understand that's a concussion. But the other things that the brain does is control your behavior, controls your mood, your just general awareness of where you are. And when you say your bell was rung, for example, there's a brief sense of disorientation, and that disorientation constitutes a concussion.
Does it require a sophisticated evaluation by someone such as a neurologist to determine if a concussion has occurred? Or could a high school coach or an elementary school teacher sort of determine whether or not something's serious enough to require more medical attention?
I think anybody could. I mean, as I just explained it, a concussion is something that you may or may not have experienced it. I'm thinking back in my life, did I ever have a concussion? I think maybe once or twice. But but I was never knocked out.
Yeah.
But if you get a blow to the head, get hit with a baseball, you're a catcher or something like that, you may be sitting there, but you're dazed, you're stunned for a few seconds. That's a concussion. I think any coach could recognize that on the field. Mm-hmm. The player doesn't have to be, have been tackled or something and then just be unconscious. Could be disoriented. And just asking somebody, do you know where you are?
Yeah.
What time is it? How many fingers am I holding up? That sort of thing. And assessing their response will allow anybody to determine whether a concussion has occurred. And I think if a concussion has occurred, that's something that should be taken seriously. Just because you fall off of a swing or something and maybe bang your head, but if you don't experience any of those disordered functions, you really don't have much to worry about.
Since you asked, I think I have had two events that might be a concussion. Once was when I was an undergraduate at UC Berkeley. I joined a club that was called the Boxing Club, and I got hit really hard, and I saw a bright flash of light, and that's when I decided I would not do any more boxing. It just wasn't worth the risk of damaging my brain as a pre-med student. And then the second time was many years later. Actually, I think we were acquainted just 10, 15 years ago when I decided to do a little bit of martial arts training, and I got hit by a knee in the eye, and I ended up in an emergency room because I was concerned about an ocular injury. And fortunately, everything turned out fine, but what I learned from that experience is that these injuries can occur sort of suddenly when you don't expect them to occur. And I think actually surveys of the public indicate that getting some kind of head injury is pretty common. It's not rare. Would you agree with that?
Yeah, well, you mentioned sports injuries, and those are things that we're becoming more aware of. In any given year, there's, people under the age of 19 who engage in sports, about 350,000 emergency department visits a year occur in that group. That's a lot of people.
Now, it's been suggested in some of the literature I read that about 85% of head injuries resolve without serious complications. Does that sound about right?
Mild head injuries. Remember, we classify head injuries as mild, moderate, or severe. And one of the ways that we classify them is how long do those concussive symptoms last. Just being briefly dazed, like let's say you get hit with you're playing volleyball. I mean, we don't think of volleyball as being a particularly dangerous sport, but that ball is moving pretty quickly and it'll strike the head, and people have been stunned briefly by stopping a volleyball with their head. If you're stunned and you feel a little confused for 10 seconds, that's considered that would be a very mild concussion. The general rule is if the concussive symptoms, that is the change in brain function because you get a little bit of amnesia, you're a little confused or disoriented, or even if you lose consciousness, if that lasts for less than 30 minutes, it's classified as a mild concussion. Well, 30 minutes is a long time to be out, but we still classify those as mild concussions. Generally speaking, of those mild concussions, about 85% of them result in no permanent serious consequences. When you talk about more serious head injuries, like moderate head injuries in which those concussive symptoms last from 30 minutes up to about 6 hours, That's considered a moderate head injury. Well, you can imagine being out for 6 hours. That's a long time.
Wow.
And that's what we're calling a moderate injury. Severe injuries are from more than 6 hours to days or weeks. That's when you're actually in a coma for that long. And those kinds of head injuries, the moderate to severe ones, more than 85% of them don't get through them without any permanent symptoms. We're talking only about mild when we're talking about that, so that's
Okay.
a large number of cases.
Right. Tell us about young kids. I understand that it's kind of a different ball game when you're talking about young children, and it might suggest that there's some other issues going on. Can you explain that, please?
Yeah. Well, there are two kinds of brain injury that you can get after a trauma, what we call focal injuries, and then more generalized or non-focal injuries. Adults who have head trauma usually wind up with focal brain injuries because the skull is basically solid. There are no sutures or movable parts, not that soft anymore. And the brain is more rigidly protected by its, by the meninges and the cerebrospinal fluid around it. So adults who have head trauma, and the kind of head trauma is important too, tend to get bruises, what are called bruises on the brain. If you have a closed head injury, which is what we're talking about most of the time, there's no penetrating skull injury, there's no fractures or anything like that. The brain just sort of bumps up against the skull, and where it bumps up against the skull, it creates a bruise, and that leaves a scar when it heals, and that can cause problems later on.
Excuse me, but I believe you have some illustrations that show this.
Oh yeah, that is how these brain injuries occur.
Right, with the head going forward and back.
Yeah, a lot of people don't know that the brain is not fixed in the skull. It's not like one solid block. There's a skull, and the brain is inside the skull, but it's surrounded and cushioned by cerebrospinal fluid and some membranes called meninges. And that allows the brain to it acts as a shock absorber and allows the brain to sustain mild traumas, mild accelerations, decelerations, without actually being injured. The point is, once you exceed the buffering capability of that system, then the brain can be injured by impacting against the skull. And obviously, if you have an injury where a missile like a bullet goes through your skull, that's a totally different thing than the kind of average traumatic brain injuries we're talking about today. Those are injuries that are incurred in battle, in serious motor vehicle accidents, falls from great heights, etc. But the kind of traumatic brain injury that we really, we need to be concerned about those as people in the general public. But it's the kind of, and people are aware that those kind of injuries are serious. The kind of brain injury we're talking about that people are not aware of are these little bumps and bangs on the head, so-called mild or even moderate head injury. And those are more serious than people think.
And you can have the injury on the side that's hit. Without getting too much into the weeds, there's a French term for that. It's called a coup injury, C-O-U-P. Then you can get a contre-coup, which is actually on the opposite side of the brain. And I believe we have an illustration that shows that. Can you just explain that briefly?
Yes. Basically, as I was saying, the brain is sort of cushioned inside of the skull. It's surrounded by fluid. It's almost, it's like a shock-absorbing mechanism. And so when the skull moves, the brain moves with the skull. But if the skull stops moving for whatever reason, either struck by an object or there's just the whole body is accelerated or decelerated like you have in a whiplash injury, the brain bounces around inside the skull just a little bit. And when it hits the skull and that exceeds that cushioning effect of the CSF and the meninges, then it can be bruised. And you can have a bruise without there being any evidence of injury on the outside of the head. It's just something that's totally internal. That's a closed head injury without even so much as a bruise or a knot on the, or even a cut, a laceration to the scalp. And those can create serious problems. And people think that if you get a knock on the head and if there's nothing that you can see on the outside of your head, that's okay. There's no need even to go to a doctor for that. And that's not true. If you have a concussion resulting from that kind of an injury, which is what we describe as these changes in function, being disoriented, confused for any significant period of time, then you do need to go and have it checked out. And you need to be aware that there are things that can result from that injury.
There's something called the post-concussion symptom scale. Is that the kind of thing that a doctor would use to assess someone, or is it just a part of a complete neurological evaluation, just one piece of the puzzle?
I think in the history, if somebody has a head injury, the most commonly used scale is a thing called the Glasgow Coma Scale. And those are for people who are in auto accidents. And generally speaking, they're not useful for people who have just had a closed head injury without any significant other trauma. Yeah. But they're useful in the sense that they do give you a prognostic indicator. If you have one of these situations where you get taken to a hospital and you're evaluated in an emergency room, the doctors there are usually going to perform, especially if you're not really responding normally, evaluate you according to the Glasgow Coma Scale, which has 3 different things that are checked. It's basically your best motor response, the best verbal response, and how you respond with your eyes. Do you open your eyes to pain? Do you not open your eyes at all? Do you open your eyes if someone says open your eyes? And the scale basically runs from 3 to 15. So,
and indeed, in the ER, they might also do a CT scan. I believe we have an image showing a contusion.
Yes, and the kind of injury that you can have to the brain is, as I was saying, is bruising. Usually, there's bleeding that you may or may not be able to see on the scalp, but there could be bleeding inside. And so a CT scan is something that they would do in the emergency department if you presented with a head injury where you lost consciousness.
How about biomarkers? There are a few that I read about. One is called UCHL1 and the other is GFAP, but I understand that they're not necessarily ready for prime time, that these are still being studied.
Yeah, one of them is called glial fibrillary acidic protein, and that's something which is released when there's damage to the brain, there's glias forming scars. There's some academic use for that in evaluating people after strokes or when some people with head injuries like chronic traumatic encephalopathy. But they're not really going to be diagnostic in most cases.
Let's change gears. Here in Davis where we're filming, it's a big bicycle community.
Yes.
Let's talk about prevention. As I go around the university, I do see a lot of bicycle helmets. When you and I were kids, they didn't even really exist, except for in a few elite athletes, and they weren't that good.
And your friends made fun of you if you wore one.
Right,
yeah.
Right. But they do make a tremendous difference, and I understand, particularly for young people who die due to head trauma, bicycles are very high on the list. So I think we should really make a shout out here for the importance of helmets if you're riding a bicycle. I was going to say a no-brainer, but that doesn't sound right. I mean, that's not really very debatable. What do you think?
That's true. And actually, if you're talking about young people, there's sort of specific kind of injuries that we tend to see relating to TBI in people up to the age of 19 who've had head injuries. And in infants and young children from the age up to about the age of 4, you know what the leading cause of death from head injury is?
Sadly, I understand that it's domestic abuse or violence.
That's right. That's exactly right. And
I know because you enlightened me on this, I must say.
No, but it's well known. I mean, you go to the CDC and they'll have these statistics available for you.
Yeah.
So that's, and what can you do to prevent that? Well, I mean, it's hardly accidental, but we could get into that. That would be a topic for another show. But then beyond that age, if kids make it to grade school, the most common cause of head injury there are going to be falls from bicycles or bicycle injuries. And there, as you say, a helmet really makes a big difference, can prevent. You may wind up with a broken arm, but at least your head is going to be protected.
We, in fact, have had a friend of our kids who were teenagers who was severely injured in a skateboard accident.
Yeah.
And skateboarders I don't think, routinely wear helmets in many cases. So this is an area of education, because wouldn't you agree, preventing a head injury is so much better than treating the sequelae of a head injury, treating the seizure disorders, treating the cognitive dysfunction. I think for bicycle helmets, particularly a lot of people who are worried about their appearance, they don't want to have a sweaty head with sweaty hair. On the other hand, having brain damage isn't so good either. It seems like we could do a better job, maybe technologically, developing better helmets, and also educationally. That's what the show is about, really.
Yeah, I think you've got it. And, in terms of, you mentioned treatment of head injuries, we have protocols for treating acute head injuries in the emergency department, in the ICU. We have some rehabilitative things that can be done afterwards, but there really isn't a magic cure for traumatic brain injury. You kind of have to deal with the sequelae of that injury, and the sequelae, as you mentioned, are things like seizures, really changes in personality and behavior, irritability. There's a whole post-concussive, post-traumatic symptomatology that includes those things: headaches, irritability, changes in personality, changes in executive function, ability to plan, mood changes like depression, things that we see in a lot of vets coming back from the Middle East.
And I know that you and I, when we met, we were working in the Department of Corrections, and there were a large number of individuals who were incarcerated who had a history of really significant head trauma, being knocked out, thrown out of windows, etc., beaten on the head with clubs. And you and I discussed the interpretation of this. Is this a reflection of how dangerous it is to be involved in criminal activities, or is this an antecedent variable that might have predisposed to criminality by, interfering with one's ability to reason and to inhibit behavior? So, it's really important as a public health and a public policy issue to prevent head injuries.
You're absolutely right, Scott. And that, you hit the nail on the head there. I gave a talk in prison. We used to have these talks, I think they were on Thursdays, or I forget when they were.
Yeah.
But there was one on head injury, and I did a survey of the group of doctors. There were about 40 or 50 people in there. I said, how many of you folks have ever been knocked out in your life? And I think a couple of people may have raised their hands. That was it. But talking to my patients that would come to the neurology clinic every day, asking folks if more than half of them said, yeah, I was knocked out. How many times? Oh, I got in fights here and there. And whether or not that was actually caused by some pre-existing behavioral tendencies, that people had to take risks to get in fights, to act out violently, or whether the head injury, which many of them occurred when they were very young, actually led to disinhibited behavior, lack of self-control, explosive outbursts. All these kind of things we see in people who have had traumatic brain injuries.
Our time is running short, and as we begin to reach the end of the show, do you have any advice for the public just about traumatic brain injury avoidance beyond what we've already discussed?
Well, yeah, actually, we could have gotten into this a little earlier, but the major cause of traumatic brain injury in older folk, people over the age of 65, for example, are falls.
Right.
Falls are very, very common in the elderly for various reasons. And just preventing falls would prevent so much morbidity and mortality in the elderly, in the older age group. Common sense things like making sure there are railings on stairs and that you use them. Taking extra care if you're going out the front porch and it's raining, use the rails. Don't climb up on ladders to clear your gutters unless you're really you have good awareness. Driving carefully. Don't exceed the speed limit. Don't drink and drive. Don't use drugs and drive. Drive impaired. Don't use your cell phone when you're driving.
That's a big one.
All these common sense things that people really could do to prevent these 2.5 or so million annual ER visits that we get for head injuries, and all the other death and lasting disability.
Yeah, this is an issue, in fact, near and dear to my heart, because as a geriatrician, I also think that we as doctors should be cautious in prescribing sedating medication.
Yep. Mm-hmm.
And also things like ambient lighting, footwear.
Yep.
This is very important. Well, Dr. Nick Capozzoli, we've only scratched the surface, but
Really?
I think that this has been an informative hour. I think we've really tried to focus on prevention. And, the expression an ounce of prevention is worth a pound of cure is kind of a cliche, but when it comes to head injury, I think it's accurate. Thank you so much for being with us. All of us here at Health Focus really appreciate your taking the time out of your busy practice.
You're welcome. Yeah.
Remember, here at Health Focus, we focus on your health. We've attempted to focus today on head injury, and I think it's been an informative hour. Until next time, I'm Dr. Scott with all the staff here wishing you the best of health. We'll see you next time. Thanks for joining us. Nick, thanks again.